Post-traumatic stress disorder (PTSD) is a mental health condition that can develop after experiencing or witnessing a traumatic event. It is characterized by a range of symptoms that can significantly impact an individual's daily life and well-being. Understanding the causes, symptoms, diagnosis, treatment, and prognosis of PTSD is essential for effective management and recovery. Causes PTSD can develop after a variety of traumatic experiences, including combat exposure, military personnel who have been in combat or experienced wartime violence, physical or sexual assault, victims of violent crimes, including sexual assault and domestic violence, accidents, survivors of serious accidents, such as car crashes or industrial accidents, natural disasters, individuals affected by hurricanes, earthquakes, floods, or wildfires, sudden loss, witnessing or experiencing the sudden death of a loved one. Not everyone who experiences trauma will develop PTSD. Various factors can influence the likelihood of developing the disorder, including genetic predisposition, family history of mental health disorders, previous trauma. Prior exposure to trauma can increase susceptibility. Coping mechanisms, individual differences in resilience and coping strategies, social support, lack of support from family, friends, or community after a traumatic event. Symptoms. PTSD symptoms can be categorized into four main groups: intrusive memories, flashbacks, reliving the traumatic event as if it were happening again, distressing memories or thoughts related to the trauma, nightmares about the traumatic experience, avoidance, avoiding thoughts, feelings, or conversations about the trauma, steering clear of places, people, or activities that remind the individual of the trauma, negative changes in mood and cognition, persistent negative thoughts about oneself or others, feelings of hopelessness or emotional numbness, difficulty experiencing positive emotions, memory problems, including difficulty remembering aspects of the traumatic event, changes in reactivity and arousal, irritability or angry outbursts, hypervigilance, being easily startled or feeling tense, difficulty concentrating or sleeping, engaging in reckless or self-destructive behavior. Diagnosis. Diagnosing PTSD typically involves the following steps. Clinical interview. A mental health professional will conduct a thorough assessment, including a detailed history of the traumatic event and current symptoms. Diagnostic criteria. The diagnosis is based on criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders (DSM-5). Symptoms must be present for more than 1 month and cause significant distress or impairment in functioning. Screening tools. Standardized questionnaires or assessment tools, such as the PTSD checklist for DSM-5 PCL5, may be used to evaluate the severity of symptoms. Treatment. Treatment for PTSD often involves a combination of psychotherapy and medication. Psychotherapy, cognitive behavioral therapy (CBT), a widely used form of therapy that helps individuals identify and change negative thought patterns and behaviors related to trauma. Prolonged exposure therapy involves gradual exposure to memories and reminders of the trauma in a safe environment to help reduce fear and avoidance. Eye movement desensitization and reprocessing (EMDR), a therapeutic approach that helps individuals process traumatic memories through guided eye movements. Supportive counseling provides a safe space for individuals to express their feelings and concerns. Medication. Antidepressants, selective serotonin reuptake inhibitors (SSRIs) such as sertraline, Zoloft, and paroxetine Paxil are commonly prescribed to help manage symptoms of depression and anxiety associated with PTSD. Anti-anxiety medications may be used on a short-term basis to help manage severe anxiety or panic symptoms. Lifestyle modifications. Self-care, engaging in regular physical activity, maintaining a healthy diet, and practicing good sleep hygiene can contribute to overall well-being. Support groups. Joining support groups can provide individuals with a sense of community and understanding. Prognosis. The prognosis for individuals with PTSD varies. Many people respond well to treatment and experience significant improvements in their symptoms. However, some individuals may continue to experience chronic symptoms, which can lead to long-term impairment in social, occupational, and personal functioning. Early intervention, early recognition and treatment can improve the likelihood of recovery. Ongoing support. Continuous support from mental health professionals, family, and friends can enhance coping and recovery. Conclusion. Post-traumatic stress disorder is a serious mental health condition that can significantly impact an individual's quality of life after experiencing trauma. Early diagnosis and combination of psychotherapy, medication, and lifestyle adjustments can help individuals manage their symptoms and reclaim a sense of normalcy. If you're someone you know is struggling with symptoms of PTSD, it's essential to seek professional help for evaluation and support.